Well, I'm honored to be here this afternoon to make just a few remarks and to see some familiar people in the audience and to thank and welcome those of you who may be here at Stanford for the first time. The Gastric Cancer Summit is a vital event for the Stanford Medicine annual calendar. Hosted by the Stanford Center for Asian Health Research and Education, the Summit and the Gastric Cancer Initiative exemplify how Stanford Medicine leverages precision health to improve healthcare delivery and accelerating life-saving research. Research focused on the diagnosis, the cure, and ultimately the prevention of gastric cancer. I want to thank the center's directors, Dr. Latha Palaniathan, Bryant Lin, and Dr. Juha Huang, thank you, for their leadership and their tireless commitment to educate and involve our patients, providers, and community about the unique healthcare needs of Asians. Stanford Medicine's three entities, the School of Medicine, Stanford Healthcare, and Stanford Medicine Children's Health, have the advantage of being co-located very close in proximity to one another. And of course, we also benefit enormously from being a part of Stanford University's broader community. Our faculty, clinicians, staff, and students work and learn alongside each other across this ecosystem. This cross-pollination allows us to collaborate and to explore new frontiers of science and medicine together. It's particularly important when it comes to the battle against cancer that these research, education, and clinical functions work together seamlessly. Why? A recent World Health Organization study paints a stark picture for cancer globally. By 2050, we will face more than 35 million new cancer cases, a 77% increase from the cancer cases we saw in 2022. While cancer death rates have fallen, the number of cancer cases will continue to grow due to an aging population in the United States and globally. As this group here today is well aware, Asian and Asian Americans in particular are at greater risk for gastric cancers. Improving education and awareness and increasing screening are both key to improving outcomes. And of course, continuing the important research that we do here at Stanford Medicine and at so many other places will reveal more about the risk factors associated with these cancers, as well as their diagnosis and treatment. What these trends tell us is that there will be a growing need for innovative cancer care around the world. Stanford Medicine has defined a shared vision for cancer innovation and care that includes the Stanford Cancer Institute, Stanford Medicine Children's Health Bass Childhood Cancer Center, and the Stanford Center for Asian Health Research and Education. CARE's mission to improve the health of Asians, Asian Americans, Native Hawaiians, and Pacific Islanders is an important piece of our strategic priority to advance cancer innovation and cancer care. I don't need to tell any of you here today that cancer treatment is a complex journey. Every patient experiences this journey from facing multiple modalities of treatment, both inpatient and outpatient treatments and interventions. These range from surgery and chemotherapy to advances in radiation therapy and, of course, immune and stem cell therapies. The complex care journey is expected only to increase as our treatments become more effective and as our ability to treat more advanced disease becomes more effective. This stands in contrast to many other conditions where advances in treatment increasingly allow them to be managed in lower acuity or even non-hospital settings. And of course, that's our hope, as we're hearing in presentations today, from appropriate use of endoscopy and the diagnosis of dysplasia, metaplasia, and early-stage carcinomas much earlier than we have in the past. But there's currently no true destination cancer center on the West Coast of the United States. And Stanford is poised to be that Pacific Rim destination cancer center. Central to our vision is the implementation of a comprehensive cancer campus that integrates research and clinical care to benefit our adult and our pediatric patients. Tight integration is crucial as this will facilitate bench to bedside, back to bench discovery, meaning that we can bring breakthroughs from our lab to the patient care environment and efficiently return care insights back to the laboratory. We aspire for every patient with cancer to have access to clinical trials, which would allow us to heal more patients, accelerate research, and discover more treatments and cures. Our vision is to ensure that life-saving discoveries made at Stanford impact patients across the globe. With a legacy of groundbreaking cancer research spanning 7 decades at Stanford, we believe the future holds even greater promise. At the same time, we recognize that everything we do at Stanford Medicine occurs in the broader context of the global fight against cancer. That is why events such as this one, the Gastric Cancer Summit, are essential to our mission. By sharing best practices in public health and community education and the latest in research and patient care, events like this help to accelerate improvement in health outcomes worldwide. I hope the talks you hear today and the information shared will energize your own research so that you can work together, so that we can all work together to better understand gastric cancer and develop more precise diagnosis and patient-centered care. Together we can and we will reduce the morbidity of gastric cancer and the mortality of gastric cancer, especially among Asian communities. Thank you again for participating in the summit, and congratulations on the great work you're doing. Thank you.